1. What is the first step in the ATLS primary survey? A. Airway assessment and management. B. Circulation assessment. C. Disability assessment. D. Exposure and environmental control. 2. Which maneuver is commonly used to open the airway in trauma patients? A. Head tilt chin lift. B. Jaw thrust. C. Mouth opening. D. Neck rotation. 3. What does the A in the primary survey stand for? A. Airway with cervical spine protection. B. Alertness. C. Abdomen examination. D. Arterial pulse. 4. During the initial assessment, when should cervical spine precautions be applied? A. Always in trauma patients. B. Only if neck pain is present. C. Only in unconscious patients. D. Never unless fracture is confirmed. 5. What is the next priority after securing the airway? A. Breathing assessment. B. Circulation assessment. C. Disability assessment. D. Exposure assessment. 6. Which of the following is a sign of inadequate breathing? A. Rapid, shallow respirations. B. Slow, deep respirations. C. Normal respiratory rate. D. Bradypnea. 7. What device is typically used to provide oxygen during primary survey? A. Nasal cannula. B. Non-rebreather mask. C. Venturi mask. D. CPAP machine. 8. What does the B in the primary survey stand for? A. Breathing and ventilation. B. Blood pressure. C. Brain function. D. Body temperature. 9. How do you assess circulation in the primary survey? A. Check carotid pulse and skin signs. B. Palpate femoral pulse only. C. Check radial pulse only. D. Measure oxygen saturation only. 10. What is a key sign of shock during the circulation assessment? A. Weak, rapid pulse and cool, clammy skin. B. Strong, slow pulse and warm skin. C. Normal pulse and warm skin. D. Bradycardia. 11. What is the primary goal of the circulation assessment? A. Identify and control hemorrhage. B. Measure blood pressure. C. Assess heart sounds. D. Check capillary refill only. 12. Which intravenous fluid is commonly used initially in trauma patients? A. Normal saline. B. Dextrose 5%. C. Lactated ringers. D. Blood transfusion immediately. 13. What does the C in the primary survey stand for? A. Circulation. B. Capillary refill. C. Consciousness. D. Cardiac output. 14. What is the next step after airway, breathing, and circulation in the primary survey? A. Disability assessment. B. Exposure and environmental control. C. Full body X-ray. D. Secondary survey. 15. What does the D in the primary survey represent? A. Disability. B. Depth of breathing. C. Diaphoresis. D. Drainage. 16. Which tool is used to assess neurological status during the primary survey? A. Glasgow Coma Scale. B. Blood pressure cuff. C. Pulse oximeter. D. Stethoscope. 17. What is the importance of the exposure step in the primary survey? A. To identify all injuries and prevent hypothermia. B. To prepare patient for surgery. C. To apply dressings. D. To assess pain levels. 18. What is the E in the primary survey? A. Exposure and environmental control. B. Evaluation. C. Edema. D. Electrolytes. 19. When should the secondary survey be performed? A. After the primary survey and resuscitation. B. Before airway management. C. During transport. D. Only if patient is stable. 20. Which of the following is part of the secondary survey? A. Complete head-to-toe examination. B. Checking vital signs only. C. Airway management. D. Initial oxygen administration. 21. How often should reassessment of airway, breathing, and circulation occur in trauma care? A. Continuously throughout resuscitation. B. Only once at arrival. C. Every hour. D. Only after surgery. 22. What is the main cause of airway obstruction in trauma patients? A. Tongue falling back. B. Foreign body. C. Laryngeal spasm. D. Tracheal stenosis. 23. How should airway be maintained in an unconscious trauma patient with suspected cervical injury? A. Jaw thrust maneuver with manual inline stabilization. B. Head tilt chin lift. C. Neck rotation. D. No intervention. 24. What is the preferred method to secure airway in trauma patients? A. Endotracheal intubation. B. Nasogastric tube. C. Tracheostomy. D. Oropharyngeal airway. 25. What is the recommended oxygen flow rate for trauma patients during initial assessment? A. 15 liters per minute via non-rebreather mask. B. 2 liters per minute via nasal cannula. C. 5 liters per minute via simple mask. D. Room air. 26. What clinical sign suggests tension pneumothorax during breathing assessment? A. Decreased breath sounds and tracheal deviation. B. Equal breath sounds bilaterally. C. Rapid, deep respirations. D. Bradycardia. 27. What is the immediate treatment for tension pneumothorax? A. Needle decompression. B. Chest tube insertion. C. Oxygen therapy. D. Observation. 28. Which pulse should be palpated first in an unconscious trauma patient? A. Carotid pulse. B. Radial pulse. C. Femoral pulse. D. Brachial pulse. 29. What does a weak or absent carotid pulse indicate? A. Possible shock or cardiac arrest. B. Normal status. C. Anxiety. D. Hypertension. 30. What is a common cause of circulatory compromise in trauma patients? A. Hemorrhage. B. Hyperthermia. C. Infection. D. Allergic reaction. 31. What is the role of chest tube insertion in trauma care? A. To evacuate air or blood from the pleural space. B. To deliver medication. C. To monitor oxygen saturation. D. To assist ventilation. 32. What is the primary purpose of spinal immobilization during the primary survey? A. Prevent secondary spinal cord injury. B. Reduce pain. C. Facilitate airway management. D. Assist with breathing. 33. What is the key sign of hypovolemic shock? A. Tachycardia and hypotension. B. Bradycardia and hypertension. C. Normal heart rate and blood pressure. D. Hyperthermia. 34. How should you manage a patient with an open chest wound? A. Cover with an occlusive dressing taped on 3 sides. B. Leave open to air. C. Apply dry gauze only. D. Apply compression only. 35. What is the priority when managing massive external hemorrhage? A. Apply direct pressure and tourniquet if needed. B. Elevate limb only. C. Apply cold compress. D. Delay treatment until hospital. 36. What does the Glasgow Coma Scale assess? A. Level of consciousness and neurological function. B. Respiratory rate. C. Blood pressure. D. Cardiac rhythm. 37. What does a Glasgow Coma Scale score of 8 or less indicate? A. Severe brain injury or coma. B. Mild head injury. C. Normal neurological status. D. Moderate brain injury. 38. When assessing pupils during the disability assessment, what is a concerning finding? A. Unequal pupils that do not react to light. B. Both pupils equal and reactive. C. Both pupils constricted. D. Both pupils dilated. 39. Why is temperature control important during trauma assessment? A. Prevent hypothermia, which can worsen outcomes. B. Prevent fever. C. Make patient comfortable. D. Detect infection. 40. What is the primary purpose of the secondary survey? A. Identify all injuries not found in the primary survey. B. Provide definitive treatment. C. Transport patient. D. Perform surgery. 41. Which of the following is not part of the ATLS primary survey steps? A. Physical therapy assessment. B. Airway assessment. C. Breathing assessment. D. Circulation assessment. 42. What is the recommended order for the primary survey steps? A. Airway, breathing, circulation, disability, exposure. B. Breathing, airway, circulation, exposure, disability. C. Circulation, breathing, airway, disability, exposure. D. Exposure, disability, airway, breathing, circulation. 43. What should be done if an airway obstruction is suspected and patient is conscious? A. Encourage coughing and prepare for possible intubation. B. Ignore and continue assessment. C. Perform blind finger sweep. D. Give oral fluids. 44. What is the primary concern with flail chest in trauma patients? A. Impaired ventilation and oxygenation. B. Pain only. C. Increased heart rate. D. Fever. 45. How is the adequacy of ventilation assessed during the primary survey? A. Observation, auscultation, and pulse oximetry. B. Measuring blood pressure only. C. Checking pupil response. D. Assessing capillary refill. 46. Which of the following is a contraindication for nasotracheal intubation? A. Basilar skull fracture. B. Mild head injury. C. Stable cervical spine. D. Alert patient. 47. What action should be taken immediately for a patient with suspected spinal injury and compromised airway? A. Perform jaw thrust with manual inline stabilization. B. Head tilt chin lift. C. Neck extension only. D. No airway intervention. 48. What is the significance of capillary refill time during the circulation assessment? A. Indicates peripheral perfusion and shock status. B. Measures oxygen saturation. C. Assesses heart rate. D. Evaluates neurological function. 49. How is disability assessed in the primary survey? A. Using AVPU scale or Glasgow Coma scale. B. Measuring blood pressure. C. Evaluating respiratory rate. D. Assessing skin color. 50. What is the most appropriate next step if a trauma patient has absent breath sounds on one side and respiratory distress? A. Immediate needle decompression followed by chest tube insertion. B. Observation only. C. Administer oral medication. D. Apply oxygen only. ATLS Initial Assessment and Primary Survey Test. The ATLS Initial Assessment and Primary Survey Test evaluates a medical professional's ability to perform rapid, systematic evaluations of trauma patients based on Advanced Trauma Life Support ATLS guidelines. This test focuses on the primary survey steps: airway maintenance with cervical spine protection, breathing assessment, circulation with hemorrhage control, disability or neurological status, and exposure environmental control. Candidates are assessed on their ability to identify life-threatening conditions, initiate immediate interventions, and prioritize care based on clinical findings. Mastery of the primary survey is essential for stabilizing trauma patients and ensuring timely, effective treatment in emergency settings. Here are the top 5 beneficial uses of the ATLS Initial Assessment and Primary Survey Test. 1. Life-saving prioritization. The test reinforces the ABCD approach: airway, breathing, circulation, disability, exposure, guiding providers to address the most critical threats first. 2. Rapid trauma evaluation. Mastery ensures clinicians can perform a systematic primary survey to quickly identify life-threatening conditions in trauma patients. 3. Emergency decision-making. It builds confidence in initiating appropriate interventions such as airway support or hemorrhage control under pressure. 4. Interdisciplinary coordination. Knowledge from the test supports smooth teamwork during trauma resuscitation, improving efficiency and communication. 5. Certification and practice readiness. Passing this portion is essential for ATLS certification, which is required or preferred in emergency and trauma care settings worldwide.